Okay, so last presentation of the day, absolutely not least. I'd like to invite Aidan McAlinden to the stage. So Aidan is the academic director also at Improve Veterinary Education. Over to you, Aidan.
Thank you, Linda, and thank you to the RCVS for the invitation to contribute and for having the foresight to have this inaugural meeting and bring together this community and start these really important conversations. So I'm going to be sharing a little bit about some insight we have about veterinary surgeons' appetite for an intermediate or middle tier qualification. And I guess it's entitled the Missing Middle, and I guess that's very much a question. Do we have a missing middle within our profession? And I'll start by, if you'll entertain me for a moment, just going back a little bit in time. And I think I'm now qualified with enough grey hairs to go back a couple of decades and consider what it was once like. But I guess we, in the past, I feel, produced competent veterinary graduates, and that's both from the veterinary graduates' feeling, but also the employer's perspective, that were well equipped to deal with the realities of veterinary practice. And I guess most continued their careers in general practice and had very rewarding careers there. A lot of the mentorship that would have been given to those early graduates would have been from the partners of the practice. We go back to a time whenever practices were largely independent. We've got a scene from the infamous James Herriot here with a newly qualified James having really the minefield of knowledge, and there was a great humility I found in terms of practice principals, practice partners, to recognise that these new graduates had this fountain of knowledge. And really what they were doing here was providing this coaching, this mentorship, and I was certainly one to benefit from that in those early roles that I had, early jobs. A relatively smaller minority decided to progress their clinical career and often did this by entering into a postgraduate certificate programme. And in the UK, that was very much the RCVS certificate, or as we refer to it as the old style certificate. And I was one such individual who made that decision back in 2005. In fact, this is the letter that I got very shortly after I received my certificate. And of course, upon receiving the certificate, I was incredibly proud. And then you get this letter very appropriately from the RCVS saying what a certificate holder was. And I'll just enlarge it a little bit so you can read it. But effectively, it identifies someone who is proved by examination to be a competent clinician in that discipline. But I think equally important, it said what a certificate holder was not, and it was not a specialist qualification. I guess at that time, it seemed to be a minority of our profession moved forward and did advanced training to become specialists with whatever authority that was. So I guess we had this pyramid at the time with the majority of our profession working in general practice and contributing in a very significant way to the profession. We had a very small number of specialists compared to the figures we heard from Julie Rosser from EBVS earlier on this afternoon. And in the middle, we had this population of certificate holders. And I certainly benefited from the mentorship of a lot of cert holders in the early stages of my career. And many of those individuals worked in this intermediate space between general practice and specialist practice and made a very significant contribution. I think we've touched on many of these points already today, but we are looking at very changing demographics within our profession. So we're hearing that graduates are graduating from vet school feeling much less prepared these days for the reality of veterinary practice. And as a result, we're recognising earlier uptake into postgraduate certificates. And some of that motivation is actually to try to close that gap, whether it be in terms of knowledge or potentially more importantly, skills that allow them to, I guess, function better within the profession. There's also been a trend towards completing these certificate programs at a faster pace, in a shorter space of time, which results in less clinical experience on completion, because in the past, again, certificates would have been done over a relatively long period of time with application of the learning throughout that journey. We also have multiple pathways to postgraduate certificate, lots of different providers of them right across Europe, and I guess that's leading to a variability in terms of the training provided, the assessment, and I guess there's a question then, is that resetting the benchmark for what a certificate is today? And equally, we're finding that there's a growing demand in the profession for advancement beyond certificate level, and certainly in a number of the different focus groups that we've held in terms of our interaction with students, we've identified lots of those individuals who have achieved the postgraduate certificate but are really looking for the what's next, and to try to set themselves apart from the growing number of certificate holders. And I think this conversation is coming at a very good time when we're speaking a lot about the flexible pathways to specialisation. Again, we saw this schematic earlier on this afternoon, and we have the RCVS Veterinary Clinical Career Pathway discussion. So if we look at academic hierarchy, we generally have postgraduate certificate, followed next by postgraduate diplomas, and then masters, or in the case of clinical qualifications, professional masters. And the question is here, is this, or should this potentially be our new middle tier? We have, with Improve Veterinary Education, several professional masters pathways validated and accredited, but we haven't brought them out to the profession and offered them as training pathways yet. Why not? I guess because we're waiting for accreditation of a number of the different modules and exact definitions of what those pathways should look like. We're taking the opportunity to engage with stakeholders through meetings like this and get feedback on some of those programs. And we appreciate that there's a lot of confusion both within the profession and the public about what all the various different qualifications mean. And we don't want to add to that confusion by entering another career pathway that's not well thought through or not aligned with maybe the pending outcomes of the RCVS clinical career pathways. And of course, we'll use this time to do a little bit of market research, and I'll share the results of that with you very quickly in terms of the appetite for a master's level qualification. So we wanted to understand what postgraduate qualifications were valued by the profession, to understand what motivations were for career progression, establish if there is a demand for a professional master's, and identify any barriers to further professional development. And we did this through quantitative means with surveys, largely with our own students, but also with non-students. And we did this across the 3 main countries that we operate in, so the UK, Spain, and Germany. And we followed this up with some qualitative research, speaking with focus groups about specific aspects that we found in the surveys. In terms of response by country, we had the biggest response in the UK, so this certificate is these results are maybe a little bit biased towards UK numbers. Most of the respondents were less than 6 years qualified, most were employees, and the vast majority were between 25 and 44 years of age. When we looked at what postgraduate qualifications we felt employers valued most, I'll represent these results according to the country, if you see the flag at the top, if they differed from country to country. But in the UK, it was a European or American or RCVS specialist status that was most valued, as we see in the red bar there, and very clearly so. Followed very closely by postgraduate certificate and RCVS advanced practitioner status. And perhaps because postgraduate certificates have been a prerequisite to AP status in the past, the two of those are equated fairly equally. In Spain, similarly, it was specialists that were most recognised, but this was followed by an official master's degree and the ISVPS Advanced GP Certs. When we asked in Germany, it was actually, and we heard this already earlier on from one of the comments, it was the national qualification in Germany that was most respected over and above the EBVS or APVS specialist status. When we looked at the primary reason why our vets want to work towards a postgraduate award, this was universal across all territories and very reassuring in that it was effectively to enhance knowledge, skills and confidence and to provide better patient care rather than about post-nominals. Having a pathway for career progression really mattered, especially in that first 5 years post-graduation. And when we delved into some of the focus groups, we found that many who wanted to go beyond their initial certificate often wanted to do complementary certificates rather than going more advanced in one discipline or specific area. We asked what the main reason you would consider a professional master's qualification as that intermediate level, and similarly, it was about growth of skills and confidence. But salary and gaining the highest qualification available in general practice started to become important with this level of dedication. In terms of the demand, the results differed a little bit in the UK and Europe. So about half the respondents in the UK said they would be interested in a professional master's. A quarter remained unsure and needed more information. And one of the big things here that they asked is that if I got a master's, would it give me something more than what advanced practitioner status currently offers? Or could I use it towards a pathway to specialisation? There was a lot of confusion about where it would sit and what the post-graduation hierarchy is. And it was felt that this could be a significant investment of time and finances if it didn't lead to additional recognition. In both Spain and Germany, there was a stronger interest in the Masters, and that seemed to be a much more familiar and recognisable qualification from a vocational point of view in those territories. And conscious of time, and this is the last slide, there was a very small number of delegates who, during the focus groups, identified that they had achieved a postgraduate certificate but had been attempting to access a residency training position but were unable to. And for that cohort, that had a much stronger interest in following and pursuing a professional master's qualification. So maybe particularly relevant to that cohort, again, that we heard about earlier on today. Thank you.
Fantastic. Thanks, Aidan. Okay, any questions from the audience? Yeah.
Hi, super interesting. I'm just wondering, are we maybe like going towards a post-nominal society where people are not so necessarily so interested in the letters you have behind your name as visualizing for employers and also potentially clients, you know, the experience that you have. And now that we have micro-credentials, you could foresee a future in which you can look up your vet and just see, I don't know, I just see like, you know, red bars or whatever, you know, I have this much experience in this. And then that allows, even if you have like 3 different certs because you're interested in complementary disciplines, people will see that, you know, as, okay, this person's really committed. Not just like, okay, well, you only have a cert in this, you're not a specialist. It's somebody who's, you know, taken a different approach. And so I'm just wondering, are we going, like, now that we have that capacity in terms of technology, and maybe we can move also in that direction, and there your masters would fit in, you know, in maybe just becoming little blocks of those pathways that people take. I'm sorry if I'm not explaining it properly. But.
Yeah, no, I think I understand the question and comment, and thank you. I think you're absolutely right, and I guess if I had more time, I would have shown you, I guess, the framework we have for a modular master's pathway. But I think one thing that's really important for us is not to stick with the dogma that these need to be within certain clinical disciplines. So effectively, we have conceived a pathway whereby you can achieve a master's in primary care practice, and that will allow you to, an individual to choose the individual certificates and modules of study to build learning around the needs of their, you know, specific practice. And I think we'll get more buy-in from the employers in that regard because they can clearly see that there's a relevance and a return on investment at practice level. But yes, it still needs that level of, if it's primary care, that recognition. And I firmly believe that primary care practitioners deserve the same recognition as someone working in a specific discipline area and going deeper in that discipline.
Thanks, Aidan. And I know you kindly mentioned our clinical career pathways work, and that is one of the work streams to look at potentially developing specialty training and further recognition for GPs. So thank you very much.
Thank you.